I want to tell you about a conversation I had with a patient, an 85-year-old woman named Martha. She was considering leaving the nursing facility she'd been in for nearly a year. Her family spoke about the costs, the distance, the logistical challenges, all the practical barriers. But when I asked her what she missed most, she didn't mention her physical health, the doctor's visits, or even the money. She simply said, "Doctor, I just want my kitchen." That phrase, "I just want my kitchen," contains the entire complicated truth about aging in place and the human spirit. It is not about the appliance itself. It is about the identity attached to that appliance, that familiar space. It is about control. It is about dignity. It is about the feeling of being home. If you or a loved one is facing the immense choice between the highly standardized structure of a nursing home and the profound freedom of home care, you've likely focused on the financials, the insurance coverage, and the specific medical needs. But according to the American Association of Retired Persons, AARP, nearly 90% of Americans over 65 state unequivocally that they want to age in place. And today, we need to understand the true hidden force behind that number. We are not talking about money or budgets right now. We are talking about the catastrophic psychological loss that begins when a person is stripped of their autonomy. The true crisis facing American seniors isn't fundamentally about increasing healthcare costs or the natural process of physical decline. It is the devastating, soul-crushing erosion of psychological dignity and personal identity that happens in a setting where they are no longer an individual, but a resident. The choice is clear, but often difficult to execute. Home is the only viable place for sustained human fulfillment and well-being in later life. In the next few minutes, we will uncover the three most profound emotional reasons seniors are now fighting to reclaim their freedom and their dignity by choosing home care. The first reason is the quiet agony of losing the smallest choices. Reason 1. The crisis of micro-decisions, the silent pain. When we discuss independence for seniors, our minds naturally jump to the big, life-altering decisions, whether to move to an assisted living facility or what final medical treatment to accept. But for a senior navigating institutional care, the deepest, most persistent suffering often comes from the loss of the smallest, most routine choices. I call this the silent and relentless crisis of micro-decisions. Think about the simple ritual of your morning. You have the power to decide whether to wake up at 7 a.m. or sleep in until 9:30 a.m. You choose the blue shirt over the red one because you like the color. You decide to have coffee first, before showering, because that is your routine. These are trivial acts in the grand scheme of life, yet every single one of them confirms your personal ownership of your existence. They confirm your identity as a unique individual. In the institutional environment of a standardized facility, these micro-decisions are systematically and impersonally stripped away. The patient schedule dictates that you wake at 6:30 a.m., not because of your own circadian rhythm, but because the nursing aide needs to comply with their rounds. Breakfast is served precisely at 7 a.m. sharp in the communal dining hall. If you miss it because you were slow dressing, you wait hours for the next meal. The necessity of institutional efficiency dictates everything. It is not malice on the part of the staff, but the sheer requirement of running a schedule for 50 or 100 people. Your dignity is chipped away day by day, hour by hour, because you are required to function as a unit managed by a schedule, not a person defined by their choices. This is the catastrophic psychological shift from being a citizen, a fully autonomous individual with rights and routines, to being a resident, a numbered unit managed by a fixed timetable. This loss of autonomy in nursing home settings, even over the seemingly minor details of daily life, like when you can use the bathroom, when your door must be open, or what personal items you are allowed to display, sends a devastating, persistent message to the senior mind. You are no longer the captain of your own soul. You are a passenger on an itinerary set by others. This quiet yet profound erosion of self-esteem is often far more painful to the senior than any acute physical ailment. It breeds learned helplessness, a condition where the individual stops trying to make choices because they know their efforts are futile against the immovable schedule of the facility. It fuels anxiety and often leads to depression, as the senior's self-worth, which is intrinsically tied to their independence, is constantly challenged. The feeling of being a burden is amplified because even simple self-care tasks become dependent on asking permission or waiting for assistance. Home care, even when extensive physical assistance is required, fundamentally reverses this psychological equation. A caregiver in the home is there to assist your life, not to run it on their schedule. You, the senior, decide the schedule. You choose the menu. You dictate the pace of the shower and the time you prefer to watch television. This immediate restoration of control over the micromanagement of daily life is not just a comfort, it is a vital, life-saving raft for the senior psyche. It means preserving the internal narrative of who you are, right down to the choice of the clothing you wear and the temperature of your bedroom. This ability to maintain daily routines and express personal preferences is scientifically proven to contribute to greater life satisfaction and drastically reduce the severe symptoms of depression that often plague seniors living in the rigid, restrictive environment of institutions. It allows them to feel seen. Reason 2. The house as the living memory bank, legacy preservation. The second, and perhaps the deepest and most spiritual, emotional reason seniors resist leaving their home is that their house is not merely shelter or real estate. It is their indelible living memory bank. For the older adult, especially one who has spent decades raising a family or building a life, the house is much more than an asset on a balance sheet. It is a time capsule of their entire existence. Think of the tangible connections. It's the kitchen where holiday dinners were prepared and laughed over. It's the warm path of the carpet where grandchildren took their first unsteady steps. It's the specific backyard tree that saw 40 seasons of growth. Every single scuff on the wooden floor, every height mark scratched into a door frame, every photograph on the mantelpiece, every piece of personal clutter is a tactile piece of their unique, unrepeatable story. To force a senior to leave this environment is not simply relocating them, it is violently disconnecting them from their own life narrative. It is a massive psychological trauma known as the loss of legacy. This concept of legacy preservation is not just sentimental, it is clinically critical, especially for individuals battling early or mid-stage cognitive conditions. The familiar environment becomes an essential, non-pharmacological therapeutic tool. Research overwhelmingly confirms that a familiar environment dramatically aids in maintaining cognitive function and actively works to slow down cognitive decline. When a person with cognitive challenges like dementia is abruptly placed in an unfamiliar, standardized, and sterile room, the ensuing disorientation and agitation frequently escalate. The known environment, their own home, filled with their personal belongings, acts as a continuous, stable reference point. It helps them hold on to their activities of daily living, or ADLs, for significantly longer. They remember where the clean towels are kept in their linen closet. They remember the sequence for turning on their familiar stove. These small, familiar acts of memory and routine are absolutely vital for preserving self-worth and independence in old age. Think again of the kitchen effect that spoke so powerfully to Martha's condition. The kitchen isn't just a room for cooking, it symbolizes nurturing, the continuity of family, and the role they once held as the foundational anchor of the home. To be abruptly transferred to a cold communal dining hall where they are merely served a standardized meal is to lose that historic, essential role in the family unit. The aging-in-place emotional benefits are deeply and irrevocably tied to this sense of belonging and maintaining their fundamental role within the family unit and the wider community. They want to complete their life story as the unique person who lived in that home, built that life, and fostered those memories, not merely as the interchangeable resident of room 3B. Their home is their final, enduring testament to a life well lived. Reason 3. The battle for dignity, one-on-one versus the institution. This brings us directly to the third core emotional driver, the preservation of personal dignity through the nature of the care itself. In many institutional settings, no matter how compassionate the individual staff member might be, the overall care model is often dictated by the efficiency and economic necessities of the organization. A senior who requires assistance with deeply personal hygiene, bathing, dressing, toileting, is often subject to a rapid, rote, and scheduled process. In a facility, this necessary assistance becomes an action on a clinical checklist, rigidly governed by the staff-to-resident ratio and the clock. It is often rushed, it is often impersonal, and fundamentally, it diminishes the individual's inherent sense of privacy and self-worth. The senior is often made to feel like a case file or a procedure that must be completed rather than a unique, dignified human being who deserves respect and patience. This is the central, non-negotiable difference. One-on-one care in a home environment is intrinsically, psychologically different from this model. The home caregiver is there for one person and one person only. This personalized attention allows for the dignity of unhurried care. The individual maintains their privacy, they maintain their schedule, and they maintain the profound human feeling of being respected as an equal in their own home. Furthermore, in this discussion of dignity, we must courageously address the loneliness epidemic. It is a terrible, heartbreaking irony that an institution full of human beings can so often be the loneliest place on earth. Loneliness is not simply the lack of people around you. It is the fundamental lack of meaningful connection and emotional responsiveness. In a nursing home, the organic connection to family, neighbors, and the wider community is often severed or severely restricted. Visiting hours feel restrictive, unnatural, and often require planning and effort that disrupts family life. Home care, conversely, is an open, natural door. It allows families to maintain a deep organic connection. Grandchildren can visit unannounced after school. Friends can drop by for an impromptu cup of coffee. The senior remains an active, integrated part of their pre-existing social network, which is absolutely vital for mental and emotional health. As the Cleveland Clinic has consistently highlighted, focusing on the patient's priorities, their comfort, their life goals, and their sense of self is critical to achieving better health outcomes and greater life satisfaction. When a senior chooses to leave the standardized care of an institution for home care, they are making a moral and emotional statement of profound importance. They are saying, "I am making my last battle for freedom. I choose dignity." The true measure of any compassionate society is how it treats its most vulnerable and how it allows its oldest members to maintain their sense of self and their dignity until the very end. The fight to return to home care is a fight against the loss of the smallest. Yet most important things, the right to choose your own mourning, the comfort of the memories you built, and the respect of being an individual, not a number in a system. It's a fight for the identity held within four walls and one simple, beautiful human request. I just want my kitchen. Now, I want to hear from you directly. Resonance point. What is the one object or space in your home that, if you lost it, you would feel you lost a piece of yourself? Share your answer below. Your story matters. Of course, making this profound emotional commitment to freedom and dignity naturally brings up the biggest, most complex question of all. How do you afford it? Don't worry. We will not leave you with the emotional commitment without providing the practical, executable solution. In our very next video, we are going to dive deep into the essential financial realities, home care, how to fund the emotional choice without going broke. Make sure you subscribe and hit the bell so you don't miss that full, necessary financial guide and the crucial steps for securing your long-term care future. Thank you for watching, and always remember to lead with dignity. Disclaimer. This content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with any questions you may have regarding a medical condition or care decision.